Are you getting ready to go in for your first ultrasound during IVF, which is going to check your egg count, and you don't know what to expect? Keep watching so you can learn more. Hi, I'm Dr. Marc Sklar, the fertility expert, and welcome back to Fertility TV, your YouTube channel dedicated to empowering your fertility. I've been helping couples from all over the world get pregnant for over 17 years with my virtual consultations and online fertility programs. If you're trying to get pregnant, subscribe and hit the bell so I can help you too. So you're about to go in for your first IVF ultrasound after you've started stimulation, and they're checking your ovaries for egg count. A question that often gets asked is, what can I expect and where do we go from here? So the first thing is, when you go in for the ultrasound, the most important thing that they're looking for is egg growth. How many follicles do you have and how big are they? So we often confuse or use these two words together, eggs and follicles. Just to be clear, the follicle has the egg inside, hopefully, and not all follicles have eggs inside, but we don't know that until the retrieval, okay? So I just want to first point that out in terms of clarification. When you go in for that ultrasound, the first thing that they want to know is how many follicles are growing on each ovary, how big are they, and are they growing or measuring close together? The goal is that you have multiple follicles in each ovary. Depending on how old you are, we want to hopefully around 10 or more, that they're growing evenly and that they're a good size. Evenly meaning all of them evenly together. Okay, that's what we're looking for. So those are the first things that you should know. It's also good, I also ask my patients to ask the question, how many follicles do I have? How big are they? Can you give me numbers? Because I like that information, so you should have that information as well. The other thing that I hear often from patients is they think that that's the only ultrasound that they're gonna need and that they might not need any more. I promise you, if it's your first ultrasound, you're going to need other ones. Typically, you go back every 2 days and at some point maybe every day to find out how they're growing and to know when the retrieval is going to be. And then a common question that we want to know as well, how much longer? Well, that all depends on growth. So we want the follicles to be a minimum of 16. Some clinics want them a little bit larger. It all just depends. And we're probably not going to have them all at the same level. So you're going to have some that are larger and some that are smaller. But on this first ultrasound, your goal is to see that you've got multiple follicles on each ovary, that they're growing evenly, that they look like they're good sizes. And then from there, you're just looking for progression and development. If you found this video helpful, there are 3 things I need you to do right now. Number 1, like this video and leave a comment below letting me know what other videos you want me to cover in future videos that I record. Number 2, subscribe to Fertility TV to get the best tips on how to get pregnant naturally. And number 3, download the IVF code. It's the must list for anyone thinking about IVF.